Sally from the Mesa Chamber of Commerce, and it's just such a pleasure to have you here this morning with us. And I just want to give you a quick overview of a handful of our members. We've got everything from AMR and Oakwood Creative Care, who are our co-chairs for this committee, Dignity Health, COPA Health, Mesa PD, Mesa United Way, just a few of the folks that are on this call. And at this time, I'll turn it over to our co-chair, Glenn from AMR, and he's going to do a little bio and then we'll get started.
Thank you, Sally, and thank you, Senator Sinema, for joining us today. Glenn Kasperzik, co-chair with Sherry as well on this committee. I very much appreciate your time and everything you continue to do for us here in Arizona, managing our everyday problem, especially with COVID and the unique challenges also in Washington. We all very much appreciate what you do and give back to the great state of Arizona. This committee has done some great work in a very short amount of time since getting kicked off last year, late in fall. My co-chair, Sherry, led a group of members on this call to get Mesa recognized as a dementia-friendly city. We're very proud of that accomplishment. And I also want to thank you and your staff, and Michelle's on this call, for being engaged in this committee and around these very critical topics that we are facing today, especially in the aging committee and homeless and those that have medical challenges coupled with COVID-19. So with that, we appreciate your time. I'll turn it over to you. We want to hear from you with what's going on and look forward to spending a little bit of our morning with you here today. So thank you.
Well, thank you so much, Glenn, Sherry, Sally, and everyone with the Mesa Chamber Aging and Healthcare Committee. Thanks for allowing me to join you on your call today. And I was really excited to hear about Mesa being declared a dementia-friendly city. And I look forward to working with the committee on promoting your efforts for seniors. So I'll first give you a little update about the Senate. Congress has to pass a continuing resolution to keep the government funded before the end of the fiscal year. So October 1st, of course, is next Thursday. So we need to do it by this coming Wednesday. The continuing resolution that's being considered this month would keep the government funded through December 11th. And it needs to get done. A government shutdown is obviously an unacceptable option, as always. This bill would extend repayment deadlines for Medicare loans that many providers have taken in order to stay afloat during the stay-at-home orders earlier this year. And the bill also prevents a steep increase in Medicare Part B premiums for seniors next year. So that's good news. But what's missing from this package is the COVID relief elements, which need to occur. And I am deeply discouraged that Washington dysfunction and partisanship from both sides of the aisle, let me be clear, have brought us to this point. So I'm going to be honest. We're not going to have a relief package before the election because the administration and Congress has really failed to solve this problem. And, you know, it didn't have to be this way. We passed the CARES Act back in March. In April, I called for immediate negotiations to prevent this very kind of incident from occurring. But to be clear, it is unclear what will happen after the election. I don't know if both sides will come together after the election to get it done. But what I pledge to all of you is that I'll continue pressing leaders of both parties to find a compromise that delivers for Arizona. A couple things I want to briefly mention that are relevant for seniors. As we have seen, there are COVID scams that are occurring and targeting seniors. I'm partnering with Arizona AG Mark Brnovich to raise awareness about these scams and to ask folks to stay vigilant. I've introduced several bills in the Senate with Susan Collins to fight robocalls and increase penalties for criminals who are targeting seniors, veterans, and other folks. There are fraudsters right now who are seeking to take advantage of this public health emergency. And we are working to try and inform seniors about this and crack down on the folks who are seeking to steal unemployment benefits or stealing money from seniors. I do have a list of tips on how to avoid scams for seniors on my website. It's cinema.senate.gov/corona/seniors. So it's a special website, just a webpage just for concerns regarding seniors. And then finally, I'll talk very briefly about a quick Arizona health update. You guys have probably heard me say this many times. Our economy won't be fully back on track until we can get this pandemic under control. Now, the Department of Health Services has reported, as of this morning, an additional 27 deaths and under 800 new coronavirus cases. Now that's fewer than in the past. We know that Mesa's dashboard showed 46 new cases just yesterday. So it's clear that the collective actions that we've been taking in Mesa and around Arizona, around social distancing, wearing masks, has really helped bring our case numbers and our hospitalization numbers down. But I am concerned about us continuing to stay the course as we head into flu season and a potential double whammy of the rise of the coronavirus again in a second wave and coinciding with flu season. So I am asking folks to help me in joining a campaign to ensure that more folks get their flu shot. Now, Glenn, you might know this, but last season, Arizona was in the bottom 10 of states nationwide to get a flu shot. So we have a lot of work to do to help folks understand how important a flu shot is this year. Right now, only 2 in 5 Arizonans got a flu shot last season, and we've really got to improve on those numbers. So I got my flu shot last week, and I'm doing a lot of work on my website and social media to talk to folks about the importance of a website. We actually have a webpage of resources at cinema.senate.gov/flu, and we'd love to help promote any flu vaccine efforts that you all might be doing. I know the Saturday events that the city is hosting in conjunction with Mesa Public Schools is doing both coronavirus testing and flu shots. We've been promoting that, and we'd like to do anything else we can to help. And then finally, the last thing I'd say before taking a couple questions is that there's a long road of recovery ahead of us. And so I've got a team of social workers that are ready to help folks who need help during this time of coronavirus. And I'd encourage them, you all, to spread the word. People can reach out to me at any time at casework@cinema.senate.gov. And we have social workers individually assigned to help people in any instances in which they need help due to coronavirus. And with that, I'll take a couple questions.
Great, thank you, Senator Sinema. Really appreciative of those highlights. This is Glenn. I have one question. In any of the new packages coming out, is there any emphasis on personal protective equipment? We've seen as this has spread, there's been some challenges around getting personal protective equipment for organizations that are in healthcare, and just the reliance on getting it, out of the country and increasing American manufacturing. Maybe you could talk a little bit about that. Is there any efforts around that to help alleviate some of the stress with personal protective equipment?
Well, it is my hope. It's what I've conveyed to both the White House and congressional leadership, that when we do a bill, it will include more PPE made in the US and made in Arizona. As we all saw, one of the problems we faced was a broken supply chain. And that problem is both a short-term disaster, but also a long-term problem. So we actually have created a task force on my team where we are helping connect people to PPE, but also we've been working with local manufacturers to help them pivot so they can make PPE in Arizona, so that we're getting rid of those supply chain issues. If folks are interested, they can reach out to my team at manufacturing@cinema.senate.gov, and we'll get them updated on the work that we're doing on this task force and connect them to entities that are making PPE in Arizona. But this is a big priority for us, Glenn. We understand how important it is, not just for the coronavirus, but for our ability to face future disasters and our ability to be prepared when new threats arise.
Senator, I'm so sorry, but your next appointment.
And it's a story of my life. I unfortunately have to get on to my next obligation. I think my team is available, though, to answer a couple more questions if folks have them.
Great. Well, thank you for your time today, Senator. We appreciate your leadership, and we look forward to continuing the discussion.
Absolutely. Looking forward to it. Thanks, guys.
Thank you, Senator.
And Michelle is on, so I know she does a fantastic job responding to people's questions. So Sally, I'll turn it over to you, and Sherry, if there's other questions from the group that we need to get addressed. But very good highlight. I think the key message also is the flu shot piece, and making sure that people are getting the flu shot this year. You know, we were on a chamber call earlier, and they were talking about, you know, where the flu is going to wind up. I never want to hedge a bet on a percentage. I'd rather lean on the side of caution. I think, you know, we want to make sure people are healthy. So yes, encourage your organizations, your teams to get the flu shot. It's readily available. I think it's beneficial, and continue to mask up. I think the other piece that I've observed, and probably many of you observed, is as the numbers have kind of come down, we're starting to see a little bit of uptick again in those numbers. And just being out in public, I see people, you know, getting a little bit more loose with mask use, especially when they're around other people. So it does make a difference. It does keep people safer. It's the right thing to do, and we'll get through all of this together. So Sally, Sherry, and the group, we have anything that we'd like to share with Michelle to get her to do some follow-up for us?
Yeah, Michelle's on the hot seat.
I also wanted to point out we have Sylvia Lee is also with us right now, and she's our policy advisor for healthcare. So she actually will be a direct source that we can get some responses from.
Okay,
great.
well,
Thank you.
Sherry might have a question or some comments.
I don't have a specific comment other than please continue to engage in the dementia-friendly classes that are being offered. And if you do want a private session, Karen Stegenja would be happy to do that for you. So yeah, we got to keep momentum going even during this time.
Yeah, we'll be promoting 2 more in the next couple of weeks. So you'll see that come out from the chamber, and then the plan would be to have kind of monthly classes online that Karen can host for the chamber. But then if anybody wants individual, you know, programs for their staff or, you know, groups, that's available too.
Sally, I just have a comment.
Yeah.
Oh, I was just going to say, one of the things that we struggled with at the hospital during the last bout of the pandemic, you know, not counting PPE and stuff like that, was getting patients to skilled nursing facilities or to rehab if they were tested positive for COVID. We had a lot of difficulty finding facilities that were accepting COVID positive patients. And also during the time that we were having struggles getting enough testing equipment in Arizona to be able to test patients. Our other struggle was if we didn't think the patient was positive, and that's not why they were here. If we didn't have a negative test to send to the SNF or to the rehab, we could not get patients out, and it really extended the length of time they were in our facilities, which then created a bed backlog for patients that needed the bed. So I know the governor and his team was working on trying to help us. I don't know if the senator's team had anything to do with that, or if they are going to be involved in case that does come around again as if we do have another surge this fall with the flu. But just something on people's radar. That was a big struggle for us at Mesa Hospital and all of the dignity facilities within Arizona.
Absolutely. This is Sylvia, and I know that Michelle and our state team and I have heard a lot about these issues, right? The inability to find a safe place for a patient, you know, to sort of go after they no longer need a hospital stay. We know that it's been a very confusing sort of patchwork across the country, state by state. You know, some governors required, you know, SNFs and other sort of short-term stay rehab centers to accept everyone regardless of, you know, a positive or a negative test result. We've been trying to handle a lot of these issues sort of case by case, and I would just say that we are always available, Michelle and I, also our casework at cinema.senate.gov. But this is something that the senator has teamed up with a number of bipartisan senators and House members to talk to CMS about the confusing sort of state patchwork, right? Because all they did was sort of release recommendations, but that doesn't actually help hospitals find a safe place for someone. And in regards to the delayed testing results, we know that it's better now, but that it was a very serious issue for a number of weeks, if not months, during sort of the peak period. So we are excited to hear that Abbott's new rapid results test that can sort of be used point of care is going to be available. The federal government has placed an order for pretty much everything that Abbott is able to produce this year. That will start being distributed to all 50 states, and Governor Ducey, as well as other public health officials in Arizona, have said that their priority will be getting them to places like skilled nursing, long-term care, and other sort of congregate care settings where you need sort of rapid test results, as well as hospitals, in addition to sort of repeated testing. So we hope that will sort of clear some of the backlog, but we know that doesn't always address the issue. So we certainly hope folks will reach out to us as you sort of come up with these individual cases.
Thank you. Anyone else? Okay, well, if not, our regular meeting is the 1st, and we have Katie McPherson coming on that call to talk about suicide. That was what we discussed at the last meeting, so we've got that set up. And for you newbies, I'll go ahead and get you registered so you can be on that call with us too. Otherwise, thank you all for making time. I know it's not our regular meeting time, so I appreciate you guys getting on this call with us. And again, Michelle, thanks for helping make this happen.